Welcome, Professor Rich RN here. I am a nursing professor and I'm also an NCLEX coach. So this channel is going to meet all your needs, whether you are here for NCLEX review or currently in nursing school trying to supplement some of the material for you. Here today, we're going to be talking about NCLEX review of common skin conditions, okay? Often an overlooked topic when you're preparing for the NCLEX. Definitely changes as we age, like most of our body systems, okay? It starts with changes at birth, and as you can see, we have a wonderful picture over here of a hand, and it is, older individual with probably some sun exposure, and so these changes that has occurred for this individual has occurred due to their genes, their hormones, and potentially disease processes, okay? Chronic sun exposure tends to increase wrinkles, tends to increase sunspots and freckles, etc. Also, smoking tends to increase wrinkles as well. And that all leads to the degeneration of our skin, one of our, our largest, actually, organ system, okay? So now we're going to jump into common kind of skin terms. I like to think of these as very important things for you guys to know for the NCLEX because they're what I call freebies. And what I mean by that is they're going to ask you usually, they'll give you a little story and they'll say it is flat, non-palpable freckles on an individual. What would you call that? Boom, a macule, right? It's not going to be A, B, C, D, right? These tend to be definitions or terms, so they're going to be the more easier ones for us to learn. If we're talking about macule, let's start there. As I mentioned, it's a flat kind of spots. They are non-palpable, meaning they're not raised. So when we go ahead and try to touch them, we're not going to feel them. They're going to be flat with the skin. Examples of what would be we consider a macule are going to go ahead and be freckles and measles. Okay, so that's what you want to kind of go with a macule. Then our next one is papule. All right, a papule is palpable, meaning it's going to be raised and it's going to be less than 1 centimeter. And that size differential you'll want to make note of because it kind of there's something that would be larger than 1 centimeter. We'll get to that term. But it's palpable, less than 1 centimeter. An example of what we call a papule would be a wart or psoriasis. Okay, and psoriasis, is this different skin condition. Then on this far corner over here, we have a vesicle, okay? This is palpable, less than 1 centimeter, so it's smaller in size. That vesicle is actually probably a little bit larger than 1 centimeter, so it's not a great picture, but you kind of get the idea and can see it good through the screen. And so it's palpable, less than 1 centimeter. Example would be a blister, okay, or chicken pox. So kind of think it's got a little bit of fluid in there. So that's how you would think of a vesicle. Okay, our next 3 set of terms. The first one we'll talk about, far right, we have a nodule or nodule. Okay, it is actually going to be hard when we palpate it. It is going to be less than 1 centimeter and it goes into the dermis. So it's the common one for that is a dermofibroma. Okay. The second one they're showing here is plaque. This is palpable or not, so meaning it can be raised or it can't be. And it's going to be greater than 1 centimeter. So your common thing for the plaque would again be that psoriasis, but the psoriasis spots are going to be much larger and then we'll call them plaque. Okay. The third one over here, you have a bulla, which is a vesicle, which again is going to be larger than 1 centimeter. So it's going to contain some things, and then a couple examples might be poison oak as well. And as you can see on this photo here, these are quite large, greater than 1 centimeter. Now, the one on the right, a pustule, I think that's the most common one we're all familiar with. It's basically kind of a pimple-like, but the difference is it has pus in it, okay? So it's a pus-filled vesicle, and so the example would be acne. And then on the far right, we have a cyst, which is going to be fluid-filled, but it's going to be very large size. I'm pretty sure if you're in nursing school or you've seen all those videos of crazy people with extra large cysts on their neck or somewhere on their body. This one is just on the forehead, kind of large, but cysts do occur all over the place and they are filled with fluid. okay? Other things we should talk about are edema. Okay, hopefully we are all familiar with what edema is. It's fluid collection somewhere in the body. The photo here is pointing to fluid collection in the patient's right wrist. And if you kind of can look at that photo, look at the other wrist, which would be the patient's left wrist compared to that right wrist. Something is severely going on right there, okay? What could it be? So if we're a nurse, what do we want to assess for if we see edema? This patient, because it's not bilaterally, there's probably some sort of trauma going on, right? If someone sprains their ankle or their knee, fluid tends to kind of build up and it kind of swells up. Some edema is going to occur. If, it's bilateral, you notice pitting edema in the lower extremities, for example, of the ankles and lower legs, that's probably going to be a cardiac issue. It's probably going to be a cardiac issue, specifically heart failure. The next one over here, picture on the right, we have diaphoresis, right? That's the medical term for sweating, of course, right? So as a nurse, when we have a patient that is sweating, what do we want to assess for with that? Well, are they in pain? Pain can cause us to kind of sweat. Are they having some anxiety? Anxiety can cause, some sweating or diaphoresis. Fever always could be something also for that as well. Also, just simple things, the temperature could be too hot. They could have just went on a long run and we're sweating, but we do assess for everything, of course, because we're nurses. That's what we do. Bromhidrosis, foul perspiration, or kind of a body odor, all right? So what are we going to assess for there? Infection, to make sure that it's actually just poor hygiene. Or is this patient have some sort of infection going on? Remember, wounds and other skin conditions could present odors as well. So if we smell something abnormal, we want to assess the skin and see if it's poor hygiene or if it's another skin condition. This one over here on the right, I think is an interesting photo. Hirturism, which is excessive hair growth, okay? Can be due to adrenal function issues. It can be due to, some other issues as well, but it's just gonna be excessive hair growth somewhere along the body, both males or females. A couple other ones, Petechiae, okay? These are red or purple spots, all right? So basically what's occurring with this in the photo down there is blood vessels or little capillaries have kind of bursted. So these are kind of signs of a little bit of bleeding going on. So we want to look at their liver functioning to see clotting factors, what's going on with that. Is there any drug reactions that are causing this potentially for another rash? Or this is a kind of a sign and symptom. That would be if, there's some bleeding or if they're on heparin or Lovenox. Those sort of things are signs and symptoms that we want to alert the patient of to look for. But also if we're caring for the patient and we see this, it's something's going on, we want to notify the doctor, okay? Then on the other side over here, we have alopecia, which is basically the medical term for balding. This patient has, random hair loss. There's male pattern balding that you've all seen, kind of, where it just kind of goes off the top. This alopecia is going off all over the place. So we got to assess for what's going on here. Is it medications? Is it fever? Is it their diet? Because if there's a deficiency, they're malnourished in protein, etc. It could be that. It could also be related to their pituitary hormones. And this alopecia can occur to both men and women. All right. Albinism, okay? That over there is lack of pigmentation in the skin. And so they're gonna look somewhat like that. Then this middle picture here is they're gonna have spotting all over their body, okay? It can be, on their face, but it can also be on their arms. It can be on their legs. The final one over here, Mongolian spots. I'm not quite sure if it's coming through on the camera, but Mongolian spots are kind of purplish spots, usually on the back side of the torso area, and they're going to be usually on babies right after they're born, and so we call those Mongolian spots. Again, it's a bluish kind of looking like a bruise, kind of, but right after they are born. Jaundice, okay, that's another common term. Usually it's related to liver functioning. Jaundice the patient can be all yellow or all jaundice, or it can just kind of also show up in the eyes, or the sclera, which is the white portion of the eyes, which is what they're alluding to in the photo. Ecchymosis, that's kind of bruising. As you can see, this patient has a couple bruises, maybe from a fall or something like that. And then cyanosis, definitely something we all need to know. Cyanosis is lack of oxygen, right? So this patient is having lack of oxygen. We're seeing blue lips. You can see blue fingers. You can see bluing in the face. It's a big alert. Something's going on with their breathing or circulation. We need to address it as soon as possible. So cyanosis is the big warning sign that you'll want to look out for. So hopefully that you enjoyed this quick little presentation on skin abnormalities.